I almost ruined a woman's life, and the worst part is that I did it with a prescription I wrote on a sticky note during a 5-minute appointment. Her name was Eleanor. She was 68, a retired school teacher who could still recite poetry from memory. She came to me for mild heartburn. I gave her a proton pump inhibitor, told her to take it daily, and sent her on her way. 18 months later, her daughter brought her back in tears. Eleanor couldn't remember the names of her own grandchildren. She would wander into the kitchen and forget why she was there. She left the stove on twice. Every single test we ran for alzheimer's came back negative. It took me 3 more months of digging to realize that I had caused it. I had turned down the acid in her stomach so effectively that her brain had starved for B12 for over a year. The memory loss wasn't dementia. It was iatrogenic, doctor-induced. I stopped that medication, started her on B12 injections, and within 6 weeks, Eleanor was back. She cried when she remembered her granddaughter's name again. I cried too, but mine were tears of guilt. I had done that to her, and I swore I would never let it happen to another patient. That was the turning point in my practice. I am Dr. Charles Whitman. I have been practicing internal medicine for 15 years, and I have spent the last 5 of those years doing something that makes me deeply unpopular with pharmaceutical reps and some of my colleagues. I started saying no. I started crossing medications off my prescription pad permanently, not because they don't work, but because the cost to the human brain is a price I am no longer willing to extract from my patients. Every 66 seconds in this country, someone is told they have dementia. By the time you finish watching this video, 20 more families will have heard those devastating words. And for a shocking number of them, the cause was never their age. It was never genetics. It was a bottle sitting on the bathroom shelf, a pill they were promised was safe, a medication a doctor prescribed, and a pharmacy filled without a single warning about what it was doing to the most fragile organ in the human body. Today, I am going to walk you through the 9 medications that I have stopped prescribing after seeing what they did to my patients' brains. I am counting them down from the ones that quietly slip under the radar to the one I consider the most dangerous and widespread threat of all. And I want you to watch very closely for number 3 because it is handed to millions of seniors for something that sounds completely harmless. And it may be shrinking the memory centers of your brain right now without giving you a single warning sign. Before we start, I need you to participate. Tell me in the comments how old you are and how many medications you take every single day. I read every single comment. The age of this audience shapes exactly what I cover in future videos, and your answers help me understand the scale of the problem we are facing together. So drop your age and your pill count right now, and let's get started. Let's begin at number 9, and do not let the low spot on this list fool you for a single second because number 9 is sitting in almost every medicine cabinet in America. Number 9 is diphenhydramine. You know it by its drugstore name, Benadryl. It is that little pink pill people reach for when they cannot fall asleep, when allergies flare up, or when a cold makes them miserable. It costs a few dollars. It sits on an open shelf. And most people assume that because nobody needs a prescription for it, it must be gentle, harmless, practically like candy. Inside your brain, it is doing something very different. Benadryl belongs to a group of drugs called anticholinergics. That is a long clinical word for a very simple and terrifying idea. These drugs block a brain chemical called acetylcholine. Acetylcholine is the master messenger your brain uses to lay down a new memory. It is the chemical that keeps you alert during the day. It is the spark that lets you retrieve a name from the depths of your mind. As we age, the brain naturally produces less of it, and it leans harder and harder on every tiny bit it has left. So a drug that blocks that chemical lands far heavier on a 65-year-old brain than a 30-year-old one. The part that takes the direct hit is the hippocampus. That is the small, seahorse-shaped structure buried deep in your temporal lobe where new memories are formed before they are filed away for long-term storage. Block acetylcholine, and the hippocampus essentially goes offline. In my practice, I have watched patients take a nightly antihistamine for years and slowly lose their edge. They become forgetful, absent-minded, a little slower to catch a joke. They never once connect the fog to the pink pill sitting by their bed because nobody ever told them to. The research connects it plainly. A 2023 paper published in the Journal of Geriatric Cognitive Health followed older adults who used anticholinergic drugs on a regular basis and found a 54% higher risk of developing dementia compared with people who stayed off them. More than half again the normal risk from something most of us treat like candy. Here is what I tell my patients now. Read the label on anything you take to help you sleep. Read anything marked PM, nighttime, or allergy relief because those are very often just Benadryl wearing a different name. If you take it for allergies, there are newer antihistamines like loratadine, sold as Claritin, that do not cross into the brain the way Benadryl does. They are far safer for the long haul. Never stop a medication on your own. I am not telling you to flush your pills down the toilet. Bring the conversation to your doctor. But stop assuming that over-the-counter means safe for your memory, because it does not. That is number 9. Number 8 is one your stomach loves and your brain quietly pays for. Number 8 is the proton pump inhibitors. The big names are omeprazole, sold as Prilosec, and esomeprazole, sold as Nexium. These medications shut down acid production in the stomach, and they are handed out like breath mints for heartburn, reflux, and that burning sensation after meals. People stay on them for years, sometimes decades, because the moment they stop, the symptoms come roaring back with a vengeance. It feels like the drug is the only thing holding the line, so they take it every morning without thinking twice. Here is the part almost nobody hears at the pharmacy counter. Your stomach needs acid to pull certain critical nutrients out of the food you eat, and chief among them is vitamin B12. B12 is the vitamin that protects the wiring of your nerves and your brain. It maintains the myelin sheath, which is the insulation around every single nerve fiber in your body. Turn the acid down far enough and long enough, and your B12 quietly drops into the basement. Magnesium drops too. Calcium drops. These are 2 minerals that your brain cells depend on to fire cleanly and signal accurately across synapses. Starve your neurons of those essential nutrients, and you get misfires, confusion, and memory slips that look exactly like early Alzheimer's. The real cause is a nutrient deficiency your medication has been blocking all along. I learned this lesson the hard way with Eleanor, and I have never forgotten it. In 2016, a massive study in JAMA Neurology examined more than 73,000 people aged 75 and older. The data was staggering. Regular PPI users had a 44% higher risk of dementia than people who did not take them. And the trouble runs even deeper than nutrients because PPIs have also been shown to raise levels of amyloid beta in the brain. That is the sticky, toxic protein that clumps together and forms the plaques we associate with Alzheimer's disease. So these drugs are hitting the brain from 2 directions at once. Here's the move I recommend. If you take a PPI every single day, that is the conversation you need to have with your doctor. Many people can taper down onto a gentler class called H2 blockers, like famotidine, sold as Pepcid, which is far less likely to affect your thinking. I also recommend D-glycyrrhizinated licorice, a natural compound that coats and calms the stomach lining, as an adjunct that can ease symptoms with 0 cost to the brain at all. The goal is the lowest dose for the shortest possible time, not a pill you take forever out of sheer habit. Number 7 is prescribed for a problem most people would rather not talk about. Number 7 is the bladder drugs, and the one to know by name is oxybutynin, sold as Ditropan. It is given to seniors who deal with that sudden, urgent, overwhelming need to get to the bathroom, the kind of overactive bladder that can reshape a whole day. The relief is real, and the embarrassment it spares people is real too. But oxybutynin works by blocking acetylcholine, the same memory chemical I have been telling you about since number 9. And this one slips across the blood-brain barrier very easily and parks itself right where memories are made. That makes it one of the most dangerous medications on this entire list for an older adult, especially when taken month after month, year after year. In 2019, the British Medical Journal published a study of people over 65 who took strong anticholinergic drugs like oxybutynin for more than 1 year. Their risk of dementia was 49% higher, that is close to 1 in 2. And here is what troubles me most as a physician. Almost none of them were ever warned. They were told a pill would calm their bladder. Nobody mentioned it might be dimming their mind at the same time. The fog gets blamed on age. People describe forgetting appointments, losing their keys 10 times a day, dropping the thread of a simple conversation. And everyone around them nods sagely and says, "Well, you are getting older." It is rarely traced back to the prescription until real ground has already been lost. If you take oxybutynin and you have noticed your memory slipping, take that seriously because you do not have to choose between your bladder and your brain. Newer drugs like mirabegron, sold as Myrbetriq, work through a completely different pathway and do not block acetylcholine at all. For most older adults, they provide the same control with far less risk to thinking. Bring it up at your next visit. Ask the direct question. Number 6 might be the most surprising one here because it is one of the most prescribed medications on planet Earth. Number 6 is statins. Simvastatin and atorvastatin, sold as Zocor and Lipitor, are among the most prescribed medicines in the world, especially after age 60. And they do an incredibly important job. They lower cholesterol and they reduce the risk of heart attacks and strokes. Statins belong in a lot of people's lives, and I am not making a blanket case against them. But what follows is the half of the story that usually gets left out of those hurried office visits. Cholesterol does far more than affect your heart. Your brain is close to 60% fat, and it uses cholesterol to build the myelin sheath, the insulation wrapped around every single nerve so that signals travel fast and clean. Lower cholesterol hard enough with a strong enough statin, and you can leave the brain short of a raw material it actually needs to function at full capacity. The statins that cause the most trouble are the lipophilic ones, the ones that cross easily into brain tissue. In 2023, a study published in Frontiers in Aging Neuroscience found that adults over 70 who had been on statins for more than 3 years had a 26% higher rate of mild cognitive impairment, and the higher the dose, the steeper the decline. Some of my patients described frightening blanks, a familiar name gone, a conversation they had just finished erased from memory, a route they had driven for 20 years suddenly unfamiliar and disorienting. The important thing to understand is that not every statin affects the brain the same way. Pravastatin and rosuvastatin do not cross into brain tissue as readily, and they are generally considered safer choices when it comes to preserving cognitive function. So if you have been on a statin for years and you are noticing fog, forgetfulness, or confusion creeping in, that is a real conversation to have with your doctor about a lower dose or a switch. It is not a reason to quietly stop a medication that may be protecting your heart. Get the plan right with professional guidance, never on your own. Quick pause. If this information is helping you connect the dots, take 1 second and tap that like button. It genuinely helps this message reach more seniors and more families who desperately need to hear it. And while you are down there, tell me how many prescriptions you are taking right now. I read every single comment, and your answers guide the content I create. All right, back to the countdown. Number 5 is the benzodiazepines. Lorazepam, sold as Ativan. Diazepam, sold as Valium. Alprazolam, sold as Xanax. These are among the most commonly prescribed drugs in America for anxiety and sleep problems. They work by boosting GABA, which is the brain's natural calming signal that turns down an overactive nervous system. At first, they can feel like a rescue. The panic eases, the racing thoughts slow down, sleep finally comes. But over time, the picture begins to change in ways that are devastating. A 2022 study published in the British Medical Journal followed more than 8,000 seniors for 6 years and found that those who used benzodiazepines for longer than 3 months had a 51% higher risk of developing Alzheimer's disease. The longer-acting medications, such as diazepam, appeared to be even more problematic because they remain in the body longer and accumulate in fatty tissues, including the brain itself. What these medications do is create a slow, insidious chemical sedation of the entire brain. Learning becomes slower, mental flexibility decreases. Many people describe a sense of emotional flatness, as if they are moving through a fog and no longer feel entirely like themselves. The cruelest part is the exit. If a benzodiazepine is stopped abruptly, anxiety and insomnia often return with even greater intensity, accompanied by agitation that can become genuinely dangerous. That makes the medication feel indispensable at precisely the moment it may be causing the greatest harm. I have seen patients trapped in this cycle for decades. So here is the rule, and it matters enormously. If you have been taking a benzodiazepine for more than a few weeks, do not stop suddenly because doing so can be life-threatening. Work closely with your doctor to taper the medication gradually over weeks or even months. There are gentler alternatives. Buspirone, for example, can help with anxiety without causing sedation or mental clouding. There are also specialized forms of talk therapy designed for insomnia and anxiety that can restore calm without the cognitive cost. Now let us move to number 4. Number 4 is a single medication prescribed for 3 completely different problems, and it carries one of the heaviest hidden burdens on this entire list. Number 4 is amitriptyline, sold as Elavil. It is an older antidepressant that is still widely prescribed today for nerve pain, for sleep difficulties, and even for migraine prevention. That versatility is exactly why it became so widespread. It looks like a medication that can do everything, but beneath the surface, it is one of the most powerful anticholinergic drugs still in common use. That means it strongly blocks acetylcholine, the very chemical your neurons rely on to communicate with one another and to store new memories. It blocks acetylcholine so aggressively that with long-term use, memory problems stop being a rare side effect and begin to resemble an expected outcome. In 2015, a large study published in JAMA Internal Medicine followed more than 3,400 adults aged 65 and older. Those with the highest cumulative exposure to anticholinergic drugs like amitriptyline over a 10-year period had a 54% greater risk of developing dementia, and almost none of them were ever told that the medication could do that. They were given it for sleep or for pain, and then they gradually noticed words disappearing, memory becoming thinner, concentration weakening, and they simply assumed it was part of getting older. It does not even require a high dose. A small nightly dose taken for years can quietly erode cognitive function without any obvious warning signs until the loss becomes significant. If you or someone you love takes amitriptyline, that is a conversation worth having soon. For nerve pain, options such as duloxetine or gabapentin may provide similar relief without the same anticholinergic burden. For sleep, melatonin or a very low dose of doxepin, which is considerably gentler on this chemical pathway, may serve as alternatives. And for mood disorders, newer antidepressants such as sertraline or escitalopram are generally considered much safer for the long-term health of the brain. Number 3 is the one I told you to watch for because it is prescribed to millions of people for something that sounds completely harmless on the surface. Number 3 is paroxetine, sold as Paxil. It is one of the most widely prescribed members of a family of antidepressants known as SSRIs, used for both depression and anxiety. On the surface, it appears to be a modern, gentle option, far kinder than many older psychiatric medications. But here's the detail that is rarely discussed in any doctor's office. Paroxetine is the one SSRI with strong anticholinergic activity. That single characteristic sets it apart from related medications such as sertraline and escitalopram because it affects the same acetylcholine system that every other medication on this list has been disrupting. In 2021, a large review published in Frontiers in Psychiatry examined older adults taking different SSRIs and found that paroxetine users demonstrated measurable declines in short-term memory, word recall, and attention within the first 12 months. Seniors taking paroxetine were 30% more likely to show early signs of cognitive impairment than those using other antidepressants. There is a painful irony in that finding. The medication is prescribed to help stabilize the mind, yet over time it may erode the very clarity it was intended to protect. The solution here is straightforward. In older adults, paroxetine is generally a medication worth avoiding when alternatives are available. The American Geriatric Society placed it on the Beers list, a formal catalog of medications considered potentially inappropriate for seniors, and paroxetine appears there for precisely these reasons. If you take it, speak with your doctor about the possibility of switching to a safer SSRI, such as sertraline or escitalopram, which are gentler and do not carry the same cognitive concerns. Supporting healthy levels of B vitamins, especially B12 and B6, may also help support mood alongside these changes. Number 2 is prescribed so quietly that many people taking it do not even realize what type of medication it is. Number 2 is antipsychotic medication. And this one concerns me deeply because many individuals taking these drugs never knowingly agreed to take an antipsychotic. The names include quetiapine, sold as Seroquel, risperidone, sold as Risperdal, and olanzapine, sold as Zyprexa. These medications were originally developed and approved for serious psychiatric conditions such as schizophrenia and bipolar disorder. Today, however, they are often prescribed off-label to older adults for sleep problems, mild restlessness, or agitation associated with dementia itself. Powerful medications designed for severe psychiatric illness are now frequently used in homes and nursing facilities for seniors who are simply confused, restless, or difficult for busy caregivers to manage. The cost can be substantial. In 2022, a study published in Lancet Healthy Longevity followed more than 25,000 older adults and found that those given antipsychotic medications for behavioral symptoms were 71% more likely to experience worsening cognitive decline within a year, even when they had no history of dementia before treatment. These medications can also increase the risk of stroke, sudden cardiac death, and the profound sedation that contributes to falls and hospitalizations. They work by suppressing dopamine, a chemical involved not only in mood regulation but also in focus, planning, and memory. Reduce dopamine enough and the brain becomes slower and less responsive. That is why some individuals taking these medications can appear dull, emotionally flat, or almost absent while their families grieve the gradual disappearance of someone who is still physically present. If you or a loved one is taking one of these medications, the first step is to ask the prescribing physician a direct question. Why was this medication started, and is it truly necessary, or is it being used primarily for convenience? Many behavioral symptoms can often be improved without medication at all through consistent daily routines, reduced noise and overstimulation, treatment of hidden pain, and better management of sleep and lighting. When medication is genuinely required, the lowest effective dose for the shortest possible duration helps reduce harm. Far too often, families are never informed about what these medications can do to the brain. They watch a decline they believe is simply aging when the true cause may be chemical. Now we arrive at number 1. Number 1 is not a single medication at all, and it may be the biggest hidden driver behind every story I have discussed today. Number 1 is anticholinergic polypharmacy. It is the danger almost nobody talks about, and it may be one of the leading causes of medication-induced memory loss in older adults. You were probably expecting one final villain, one single worst pill. The reality is more subtle and more insidious. The greatest danger often comes from the slow accumulation of multiple anticholinergic medications taken together while nobody calculates the total burden. Polypharmacy simply means taking many medications simultaneously. Anticholinergic burden refers to the combined effect of all of those medications blocking the same memory-related chemical at the same time. Imagine a very common scenario that I see almost weekly in my practice. A senior takes Benadryl every night for sleep. They take oxybutynin every day for bladder control. They take amitriptyline for nerve pain. Individually, each medication may produce only a small and barely noticeable effect. Together, however, those effects compound exponentially, and the burden on the brain rises rapidly. In 2022, a study published in Age and Aging tracked more than 280,000 older adults and found that those with the highest anticholinergic burden had a 120% higher risk of dementia within 10 years. That is more than double the risk, and the overwhelming majority had no idea they were taking anticholinergic medications at all. No one had ever explained it to them. When acetylcholine is blocked from several directions simultaneously, the brain does not simply slow down. Neurons can begin to weaken from underuse. Connections may shrink. The brain can settle into a quiet, underpowered state that looks remarkably similar to Alzheimer's disease during cognitive testing. I have seen patients who were misdiagnosed with early dementia who actually had nothing more than a stacked cocktail of anticholinergic drugs. We reduced the burden, and their cognition rebounded. It was not Alzheimer's. It was iatrogenic. Here is the hopeful part, and it is the reason I made this video. Medication-induced cognitive decline is often reversible when it is identified early. Reduce the burden, and many people regain clarity, energy, and memory within weeks or months. The brain is far more resilient than many people realize, but only when the source of harm is removed. The solution does not require a miracle. It requires a careful, thorough medication review. Sit down with your doctor or your pharmacist and review every prescription medication, every over-the-counter product, and every supplement you take. Add up the total anticholinergic burden. Simple scoring tools are available online and in clinical settings to help identify that risk. Once the problematic medications are identified, unnecessary drugs can be reduced or discontinued under medical supervision. Safer alternatives can be introduced, and the brain can be given an opportunity to heal and recover. This may be the most preventable threat to the aging brain on this entire list, and that is exactly why it holds the number 1 position. I have stopped prescribing these 9 categories not because I do not care about the conditions they treat, but because I care more about the person taking them. I refuse to trade a patient's mind for a quiet bladder or a calm stomach. That is a bargain I am no longer willing to make. Now I want to hear from you. Of these 9 medications, which ones are currently sitting in your medicine cabinet? Have you noticed brain fog or increasing forgetfulness after starting a new medication? Tell me in the comments below. And tell me that you will ask for a medication review this week. Your answer might be the very thing that helps the next person who reads it. We are a community here, and we learn from each other. And before you go, there is one more place your body hides its warnings. Your medicine cabinet is one place, your hands are another. Your fingernails can reveal warning signs involving your kidneys, your blood, and even your nervous system years before other symptoms appear. Most people never learn what to look for, and those signs can save your life. That is the topic of my next video. I will show you the 4 nail signs worth checking tonight. I am Dr. Charles Whitman. Stay sharp, protect your mind, and I will see you there.